All right, let's get going. Can you introduce yourself for the tape?
Hi, I'm Dr. Elaine Batchlor. I am the CEO of MLK Community Hospital and Healthcare System. And I believe we can do a better job of providing healthcare for our residents and keeping our population healthy.
I agree with that. All right, so tell us a little bit about MLK Community Health and a little bit about the community that you serve.
Sure. MLK Community Hospital and Healthcare is a health system that is located in South Los Angeles. We serve over 1 million people who live in the community of Watts, the city of Compton, and Linwood. It is a historically underserved community of color. The hospital system that I lead has its roots in the Watts Uprising of 1965, and it's really a system that serves a very low income community that is mostly brown and black people.
That is really critical, especially in a moment like this one where we're watching as this administration is targeting these communities in pretty direct ways, especially considering the way that they weaponized our military against people in LA. I want to ask you, just stepping back, what are the biggest challenges that you face running a healthcare system that cares for lower income communities of color in an urban environment?
So I think the biggest challenges that we face are the lack of resources and the lack of healthcare infrastructure. So this community evolved over time as one of the few communities in Los Angeles where African Americans could live and was subject to redlining and to housing covenants. And over time, it became a community of concentrated poverty that lacked a lot of the same type of social infrastructure that you see in other parts of most cities. So really lacked education, housing, transportation, employment, and had an almost complete lack of access to healthcare. And that lack of healthcare infrastructure has persisted over time. Today, we have 1/10 the number of doctors in this community that your average community in California has. We're missing 1,500 physicians here, and it's really a desert of all kinds of healthcare.
One of the aspects of this is I'm a two-time health director, largely in urban communities, and one of the things that doesn't get talked about often is that it's not just the lack of healthcare access, as you talked about. It's the lack of the means of health in the first place, right? When you provide healthcare for communities who, by definition, lack access to healthier foods or breathe more polluted air or go to schools that don't spend as much time, energy, or money educating kids, all of these things are down to make people sicker in the first place. So when you're in a situation where you're caring for people's health in those communities, it's just harder by definition to do. And so it's not like you need the same amount of healthcare resources. In fact, you need more healthcare resources in communities like this.
Yes, that's absolutely true. All of the things that you just cited, the lack of safe places to exercise, the exposure to pollutants, the lack of transportation, all of those things are related to healthcare and healthcare status. And as a result, it's also a community where health indicators are much worse than in the rest of the county, where diabetes is epidemic, where behavioral health challenges and um, chronic illness are epidemic for those same reasons that you just cited, the lack of social infrastructure.
Yeah. And I really appreciate just the heroic work you all do every day to make health possible for folks in those communities. I want to now step into the space that I think a lot of our minds are in, which are around Medicaid cuts, because a large proportion of your community, if they're insured at all, are likely insured on Medicaid, or in California, as it's called, Medi-Cal. Um, as you started to hear about, Medicaid cuts and the work requirements that they're trying to impose on folks to get access to that. What was your reaction early on before this actually big ugly bill got passed?
Well, as soon as I started to hear about the possibility of Medicaid cuts, I became very concerned. We are already struggling with insufficient funding and insufficient resources to meet the health needs of our community, and cutting back on what we have now will just make matters worse. Our community is so low income. Medicaid is the predominant payer. Our patients and our residents are dependent on Medicaid, and we as a healthcare provider are dependent on Medicaid. And unfortunately, it already doesn't cover all of the costs of providing care. So hearing that it's going to be cut makes me even more concerned about our ability to continue to serve our community and about our community's access to healthcare.
What's that going to look like for people? Can you paint a picture about what that looks like for you? What are your worries as we head into this new regime of an era where Medicaid is getting cut for folks who otherwise would get care at your hospital?
Well, we're taking a step backwards. We're going back in time. We've seen what that looked like in the past, and what it looked like is even worse access to care. It looks like residents who will lose access to prevention, primary care, early detection of diseases, and disease management. People who will then forego getting health care until their conditions are much more serious, at which time they will then be forced to present to emergency departments and community hospitals, and will have more expensive and more advanced medical problems than if they had gotten care earlier in the course of a disease, or gotten the type of prevention that we know everyone needs. So I think that, what it's going to look like is less access for our community. It's going to look like providers struggling to stay open and continue to offer the services the community needs. And when some of these providers close, patients will then overflow into adjacent communities where they will also put a strain on their access to healthcare resources. And it also looks like providers absorbing uncompensated care, what we call uncompensated care, which is what happens when people are finally forced to go into an emergency department. We're required to take care of them. They're not able to pay. We have to absorb that cost. And that will make financially fragile providers even more shaky. Some of them will close services, some will have to close down. Providers in more affluent communities will pass those costs along to people who are privately insured, and healthcare for all of us will be more expensive. So I don't really see it being a positive for any of us.
Yeah, that last point, I think, is something that people don't always appreciate. Is that when you start imposing these work requirements on Medicaid, it's not like these people who are kicked off the Medicaid rules don't still need healthcare. They're just going to get it in the most inefficient and expensive way, right? And it's inefficient in the sense that it's better to prevent the disease than to let the disease fester and care for it when it's emergent. And it's expensive because emergency rooms are just really, really expensive. And that cost that gets borne on to the rest of us. And so people don't really understand that, like, when we talk about the bill, right? Yes, that is that thing that got turned into law, but there's also a bill that comes due. Like, we're going to end up having to pay for it, all of us who may have private insurance, because either we're going to watch as our rates go up because of the renegotiation that has to happen for hospitals to try and push more of this uncompensated care onto us, or it's going to come due because hospitals that we previously could go to get healthcare, particularly in rural or urban communities, are going to shut down. As you think about how you make up for that uncompensated care, have you started to think about what your plan looks like in a world where you're going to end up having to try to eat more of this cost?
Well, yes, we are starting to think about it. And I just want to comment on one aspect of what you just said about people having to go to providers and hospitals in other communities. This community has actually been through that experience.
Hmm.
The original hospital that opened after the Watts uprising, which opened in 1972, closed in 2007. And when
Wow.
that hospital closed, the people who lived in South LA went to hospitals all over the city and the county. And so those hospitals will be impacted if services at this hospital are impacted. So we are going to do everything we can to keep this hospital open and continue to serve the people in this community. One of the things that we've already started to do is to work with our state and local healthcare leaders on on things that can start to fill the gap in federal funding. Unfortunately, a lot of states are not in a position to be able to fill the gaps that are going to be left by the bill, but we need to start talking to folks about that.
I want to ask you, right, because there are a lot of unique communities that have been targeted by this administration, and none more so than undocumented folk. And I want to ask you, this is all coming at a time where ICE raids have become, just flagrant in terms of they said they were going after the quote unquote criminals, and then they wanted to make everybody quote unquote criminals. Now you're seeing babies get separated from moms, and moms get separated from babies. And so this is a community that has been targeted in a really profound way, and even folks who have some legal status still are finding themselves caught in the system. Folks literally coming out of their court appointments and getting picked up by ICE. How will this and how has this moment affected the kind of care that you can give to undocumented people? And then what are the long-term implications of our the inability to provide quality care for this community for everyone?
Well, I think that, two things come to mind immediately. First is just the fear that people have to even go to the doctor or go to a hospital when they're sick and they need care. So we've already seen a ripple effect of people being fearful to go to see a doctor for their regular appointments and regular medical care. So I'm concerned about that because again, if they don't get that primary care, prevention, disease management, um, they are going to get sicker, and we're going to end up paying more to provide, higher tech rescue care for patients. Um, and then the second issue that I'm concerned about is the decrease in resources that we will have as a provider that will make it harder for us to take care of all of our patients as a result of the federal Medicaid cuts. And, again, it will have the same effect of forcing people to wait until they are sicker to get care. It will cost us all more, and it'll put more strain on an already shaky healthcare system.
Yeah. And that's the thing that folks don't understand is that, like, at the end of the day, our failure to care for any of us ends up making it harder to care for all of us. As much as we like to think of ourselves as individuals disconnected from others, we all live in this place, and when we don't consider what's best for any of us, we fail to consider what's best for all of us, and frankly, the life that we save might be our own. I want to ask you, right, because this comes on the back of a moment in 2024 where the expansion of Medi-Cal to include income eligible adults, regardless of immigration status, was really a big win. And it seems like a lot of that is getting rolled back now. Can you speak to like the interim difference of what it was like to have that expansion and then what it's going to look like now?
Uh, well, I think that what the expansion brought was the ability of everyone to at least have a primary care provider and to have access to medical care when they need it. And I think that the difference is going to be huge. People are going to avoid going to doctors. They're not going to be able to afford to go to doctors until they are quite sick. And we're going to see access worsen. We're going to see health status get worse. And we're going to see providers weakened by having to absorb more uncompensated care. So I think we're going back to the days when hospitals had, very significant uncompensated care depending on where they're located. And if you're a hospital like ours that's located in a low income community where there aren't a lot of privately insured people, we're talking about an increase in a significant increase in uncompensated care at a time when we're already struggling to keep our doors open. So I think we're looking at, sort of the wholesale weakening of our healthcare safety net.